Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the consult before the the consult before the cut.
Coffee.
I was about to say it's just Taylor and I, unsupervised here today. And
We should have brought cocktails. What the heck?
One of these days we're gonna do superior margaritas.
Yes.
We're gonna do superior the day
When I don't have to go back to clinic after.
That's it. We're just gonna just get down with it. So yeah, it's just me and Taylor here today. Dr. Weiler is off probably running the world somewhere, just making moves and doing things. So you got us today. Before we get started, obviously we want to go ahead and thank Rejuvime Medical, your anti-aging clinic, longevity clinic, helping us stay our youthful selves well on into our elder years. Everything from hormone replacement, peptides, GLP-1s, aesthetic injectables, anything that you're looking for to keep that youthful you, we got it at Rejuvime Medical. We're all over the state of Louisiana and even into Mississippi, in D'Iberville, Mississippi, which is going to come into play in just a minute. And then, of course, Weiler Plastic Surgery Group, the largest plastic surgery group in Louisiana, five board certified plastic surgeons. I know I can't talk today. 5 board certified plastic surgeons, amazing expert injectors led by yours truly over there. Whoop. And then all of the estheticians to keep us feeling beautiful, the skin doing the most all over the body. Amazing work, the Lord's work that y'all are doing over at Weiler Plastic Surgery. Okay, so today we're going to kind of talk about something that obviously it's everywhere. If you don't know about GLP-1s, you are living under a rock somewhere. I mean, it's everywhere. And just the evolution of GLP-1s from injectables. Now we have oral versions of GLP-1s.
So that's what we're diving into today. I'm super excited about that. I've wondered how long it was going to take to be here.
Okay.
And it's been around for a long time?
Forever. So the thing about it is oral semaglutide has been around forever. It was called Rybelsus.
Okay.
Rybelsus, but so with Rybelsus, it's kind of like the same way that injectable GLP-1s came out. They came out and they were first FDA approved for diabetes. They were not FDA approved for weight loss. Then you saw the Ozempic and you had the Mounjaro and then you had the Wegovy come in and then the Zepbound come in. And the Wegovy and the Zepbound are specifically FDA approved for medical weight loss. And so that's kind of like where this differentiates.
Semaglutide, and
Wegovy
Zepbound
is semaglutide. Zepbound is going to be tirzepatide.
Okay.
Now there is not, at this time, Eli Lilly has not come out with an oral Zepbound.
Okay.
I can only imagine that it's in the
oral
works.
tirzepatide.
Yeah, which is that oral tirzepatide.
Okay.
And like I said, I can only imagine that it's in the works.
Yeah.
But I do know that they're starting to work on a lot more advanced of these oral GLP-1s. Now they have, ones that are going to act on 2 receptors instead of 1 and 3. And so it's like, this is going to be an ever evolving category of medicine. Like as soon as we tapped it, it's like, this is where.
So on label for weight loss, GLP-1 agonist orally is Wegovy semaglutide only right now.
Correct.
Okay.
Correct. So like I said, Rybelsus has been around for many moons and it was used to treat diabetes.
Right.
And so once, I think it was Novo Nordisk was able to get the FDA approval for oral semaglutide, they took it and now it's Wegovy oral. Everybody has just been like, I always think that there's a fear. People have fears of injections. Mm-hmm. And when these medications come out in this injectable form, it's like, yes, 9 times out of 10, they're going to take the injectable form. But you have some other patients that scared of needles and they don't want to inject themselves and they're nervous. And it's just like, is that
what percentage of patients do you think that is?
A very small amount. Okay. Because you have to think about it. You're playing on like how bad you want it.
Correct.
You know what I mean? And if you're at a point in your life where you're looking for that weight loss, that medical weight loss help to get on board with that, you're typically going to be okay with it doing the injection. But you can't, you can't just like throw the ones to the wayside that have needle phobias and stuff like that. There still should be an option for them as well. And now it's out there. And
how long has Wegovy semaglutide, oral been? December?
January?
Not
December,
long.
January? No. It's literally within it was December, January that they came out with the FDA approval for that. So like I said, the FDA approval for the weight loss, the oral semaglutide has been around forever.
I wonder how it's going to go with, I know that it's picky. You have to take a pill every day. And when you have to take the pill and versus just once a week injection.
Once a week injections typically is what you're going to do with your injectable GLP-1s daily dose. So this is going to be part of your daily medication regimen. You're going to take this dose every single day.
Okay.
And some people are totally okay with that. I know you probably take 1 million vitamins.
Yeah.
Not for Alzheimer's.
Yeah, but I'm wondering, I know, right? I'm wondering do you have to take oral semaglutide by itself? I know we're bringing on somebody.
I was about to say, we are going to bring in, like I said, this is going to play a part, de-Iberville. So one of our nurse practitioners down there, Taylor, absolutely amazing. She's really going to dive into it. I just think, as far as us talking about it right now, it's just that we're starting to get options for patients. And I think that's so important because, you do want to make sure that you're treating the mass, you're treating the masses and having options for the masses and not just having one thing that you can give them. So
another thing I was thinking about is that it has to be refrigerated and pills don't. So if you're traveling, like I don't want to miss my shot or miss my whatever, you could travel with the pills. Can you do that?
Yes, you can travel with the pills. And also and I'm going to get Taylor's input on this as well, because, sometimes kind of what I see too is, okay, let's say you have been on injectable GLP-1s for quite some time. You're at your goal.
Right.
You're at your goal. And you're like, I am good to go now. And you're just like, man, I just don't feel like doing the injections anymore.
Can you transition?
Can you transition to an oral GLP-1 for maintenance? So I do think that there is a lot of different options out there on how it can be used.
That's true.
That's what, and I want to get Taylor's opinion because obviously she's going to be the one who's talking directly to these patients and getting the feedback from the patients when it comes to oral GLP-1s. So I just think it's it's an exciting time to be able to have these types of options.
This is huge. This is huge.
Well, you think about back in the day when you talk about weight loss clinics and everything like that. You remember when it was an oral option at Adipex, you were literally on prescribed speed.
I know.
To lose weight. And it's there were so many health risks with doing stuff like that.
What was Aspen Clinic?
Yes.
That was where you would go to get that.
You could get Adipex from the Aspen Clinic. Yeah. Absolutely. And you had to go in, and that was another thing. Because Adipex was a controlled substance, you had to go in every month. And because it was such an abused drug, because once again, it's literally just oral speed. That's all it was.
Yeah,
and you were going
with your heart.
You're jacked up heart rate, jacked up blood pressure. And so it's the side effects to it were just oh my gosh, is this worth it?
Right.
And so being able to have something that's not going to have those terrible cardiovascular side effects that go with it, this is a whole new realm of things. And this is going to be so much better.
Yeah, this is cardio supportive. So I'm excited to dive in.
So I know it's going to be really, really good. So I think, I think we can go ahead.
Yeah, let's bring her in.
I think we can go ahead. So what we're going to do, take a super quick break. We're going to bring Taylor on and we are going to get her opinion from the nurse practitioner side of things, who is seeing patients and talking to these individuals and seeing exactly what they're asking for. And we're kind of going to get into the mechanism of how it all works. Yeah. So hang around. I'm not going to say stick tight again. Hang around and we'll be right back in just a second.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52. and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters, we all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. You know, the college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
All right, everyone, welcome back. We are really going to dive into it now. We have our lovely guest with us, Miss Taylor.
Taylor Parrish in
the house. She is at Rejuvime Medical's D'Iberville clinic, and it's not D'Iberville, just FYI.
Okay, I thought it was.
It's not. I got quickly corrected. When we first started going down there to open this up, it's D'Iberville. So we have Miss Taylor here from D'Iberville, and Taylor, thank you so much for coming on to talk to us about this super hot topic that we've got going on. So tell us a little bit about yourself, ma'am.
Yeah. Okay. So I'm Taylor Parrish. I am the nurse practitioner for D'Iberville's clinic. Fun little fact, I'm the only Mississippi provider, so I get the really special benefit of adding all these patients over in the Gulf Coast, which is super special.
Yeah, that's amazing.
Yes, yeah, it truly is. I've been here. Next week will be a year, so very excited to continue offering this type of care to patients. We really needed this in this area. It's been fantastic. Can't say enough good things about it.
Okay, so before Taylor was doing this, she was taking care of the babies.
Oh,
and
really?
The mamas and the babies.
I did. I was in the women's health world before, and I spent about a decade in labor and delivery.
Wow.
Primarily.
I know.
And it was the best 10 years of my life. Loved it.
Wow.
So I'm like, you went from dealing with a specific type of hormonal women, and then you left that and jumped right back into
but you have the full
different
gamut of experience. I mean, truly.
Yes.
Wow.
I feel like I used to tell people that when I was a labor and delivery nurse, I was taking care of a very vulnerable population because most people are really afraid of pregnant people. But then too, now I've transitioned to this caring for women in another part of their, or another vulnerable part of their lives where their hormones are imbalanced and nobody's listening to them. They're just slapping them with the label, oh, you're depressed. Oh, you have this. Oh, you have that. Move on. So I feel like it's been a really good transition. It's very fulfilling.
I love that. I love that. I know. I love Taylor. She's fantastic.
You're cute.
I love it. Don't worry. We'll sucker you into doing these quite frequently. Okay. So, all right. So obviously we're going to talk about oral GLP-1s. And before the break, Taylor and I were just kind of discussing how this has been such a large movement, but something that needed to happen. Like these are giving options. And now that we, because over at Rejuvime, we've had injectable GLP-1s for, many moons now. And, with the FDA coming out a couple months ago with the FDA approved oral semaglutide, which is the Wegovy, I mean, this is opening up doors for a lot of different people. And so
absolutely, I agree.
Yeah. And so are you, first of all, let's just talk about GLP-1s in general. So obviously GLP-1s are medications that are acting on a very, 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 very specific receptor that is going to help you stay fuller longer, get that full feeling that you're not just like chowing it down.
I always say it lessens the food noise.
Yes. It definitely lessens the food noise. And also
blood sugar regulation.
That appetite, blood sugar regulation. What we're also seeing is a lot of anti-inflammatory properties and everything with the GLP-1s. But kind of talk to us a little bit, Taylor, just about GLP-1s in general.
Yeah. So I absolutely love these. Whenever whenever they first came into the playing field, we heard all about how it's just a crutch, right? It's just for weight loss. It's the easy way out. And so we know that these go so much further past that scale. My coworker, Allie, one of our other providers in the Slidell location, we recently did a presentation on these medications to a bariatric group. And we were talking to them about how it goes into what you just said, inflammation purposes for GLP-1s, and saying it's a huge difference. I have some patients that are specifically on it because it helps with their rheumatoid arthritis. That's a huge jump. I have patients that report decreases in depression and anxiety symptoms. We know that the semaglutide right now is in its third trial for decreasing the risk of Alzheimer's and dementia. So I think that's a huge jump. We also have other benefits too. Obviously mental obesity or pre-obesity are not just a character flaw. Sometimes it's a true metabolic issue. And so food addiction, things like that, the food noises, the cravings that we were talking about, all of those are controlled through a very specific way that these medications work. And depending on what your metabolic status is, you may benefit from something like this, even if you're not severely overweight or you're not diabetic. So GLP-1s, I mean, they have so many different functions in our body. It's so cool.
I know, Dr. Weiler always talks about how, microdosing GLP-1s for anti-inflammatory options, and just like she's saying, it's like, it is literally, I mean, this is just opening up a huge realm of things that it's like something that obviously started, from a diabetic standpoint. It's just like the amount of other things that it affects is just so beneficial on so many levels.
Right. When will you tell us the difference between obviously oral injectable, the route of transmission, obviously oral injectable, but timing, we kind of briefly discussed that. The onset of this working for the patient. Give us kind of just like the beginner steps of injection versus oral, and then we'll dive a little bit deeper.
Yeah. So obviously injections have been around for quite a while. We know that typically we do once weekly injections. There are people that benefit from what Brittany had mentioned, microdosing. So depends on like what your schedule is, how compliant you can be, that one versus the other may be better for you. The oral form is a daily dosing, and it's very important to stick to a consistent regimen when it comes to that. We want you to be in a fasting state, and we want you to continue to hold that fasting state for at least 30 minutes after you take this medicine. So it's a little bit more strict, and same thing for when you are taking it. You don't want to go missing doses because I like to refer to like birth control. We don't want a pregnancy. We've got to take it same time every day. You got to make sure. So obviously we're not preventing pregnancy with this, but we are trying to keep you out of therapeutic range. And so it's very important to be very consistent with your dosing. It's convenient in other aspects. If you're worried about injections, nervous about injections, giving them to yourself, or you don't have somebody that's able to give them to you, don't want to come to clinic therapy, things like that, it's beneficial. Or somebody that's traveling often and can't carry their medications and keep them refrigerated. There are really big benefits to both. It just depends on weighing all of your options and what would work into your own schedule.
Yeah.
Now, as far as the dosing goes, as far as like how I guess long you can go between, the injections are usually lasting you about a week in between shots for your symptoms controlling. If you're going without your medication daily, I'd say after about 2 days, you may start to really have a severe symptom re-onset where you have more cravings, more noises, more hunger. So you just have to be really consistent with both regimens for success.
Yeah, this would be like Taylor, you would have to like take it, then do your workout, then do your eating.
And it says like half of a cup of water whenever you're taking it. Like you have to be fasting. So first thing in the morning, and then you can only have like half a cup of water and then nothing for 30 minutes.
Yeah.
So it's pretty strict.
It's crazy.
Yeah.
It is strict.
It's very reminiscent of like thyroid medicine.
Yeah.
Like you always want to take your thyroid medicine on your empty stomach 30 minutes before anything else. But yeah, I mean, and some people I know, like my brother, I say my brother, his feet hit the floor. And if he doesn't eat like immediately. Super grumpy man. But like, that's his thing. Like when he gets up. And so it's like for somebody like that, you'd be like, oh, that's maybe the injection. Yeah. Is that you?
Oh, yes, absolutely.
Yeah.
I want to talk about the
thyroid is a great point. Thyroid's a great point.
Right.
Taking that too, you have to think about what other medications are in your regimen where, if they're, you can't accommodate, waiting 30 minutes to take your thyroid medicine after you took your GLP-1 and then waiting another 30 to 60 minutes for both of these to absorb appropriately. You got to think about things like that too.
Yeah. Weighing your options. What's best for you?
Absorption wise though. So
yes.
Let's talk about that. Oral. Different. Yeah. Let's talk about that.
So the dosing between these two injections are going to be like a lower milligram dose, right? So in comparison, let's say the 1.25 milligrams, which is 25 units for us, things like that. That is in comparison to our 12 milligram dose of our oral semaglutide. So when we have that, it looks like it's way more, but it's because of the bioavailability of these two medications. The injections are obviously absorbed through subcutaneous layers, so we are getting it into the circulatory system in a different route. And then the by mouth is going to be something that your oral mucosa and that upper GI tract is what's absorbing. So we have to kind of change that dosing to make sure that you're getting the appropriate amount absorbed. And so it just depends on the route difference.
Yeah.
So whenever I was researching all this before, it says, okay, so whenever you're taking the oral, you're doing, usually you'll start 1.5 for 30 days, right? And then titrate up 30 days, titrate up 44, 9, 25. Are you giving them all of that medication at one time and saying, increase this at day 31, increase this day at...
Are you talking about like doubling up on the medication? Like saying, are you just talking about like a 90-day regimen?
Well, you're titrating.
Me personally, I prefer to do this in like a, I would say like a 30-day order. So how we do our injections, what we typically have you start out with is the lowest dose possible for at least 4 weeks at a time, and then we increase slowly from there. If you do a little bit too soon in increasing your dosing, we could cause those symptoms to really increase or have any significant negative side effects, like your pancreas is a little overstimulated. So I personally would like to order, a 30-day dose of this, and then we can get you a refill for increasing the dose, as tolerated. If you're tolerating it well and we're okay, then that's fine with me. Let's go up to the next dose.
Yeah.
Did that answer your question?
Yes, kind of. Yeah.
Because I do feel that, like, when she's talking about the injections, like with the side effects and everything like that, some people starting on the lower dose, 4 weeks later, they increase to the next dose. They're good to go. They increase to that third dose.
Yeah.
And the nausea and vomiting that's associated with it, they're like, oh no, let me come back down. And so the same thing.
Okay, but that's my question. Can you break a pill in half? Like in a syringe, you can not pull as much of the product in the syringe. If it's a pill, if it's a 1.54, like you can't cut back on. You have to go back to the 1.5.
You would have to go back to the original dose, right? So, so you would have to go back down to the dose. It's okay. Yeah. It's so these won't be like, oh, I'm just going to take like half.
Yeah.
I'm just going to take half. But Taylor, if you were having significant side effects, would every other day be an option, or are you running into losing that therapeutic range you're trying to achieve?
I would be afraid of not being able to keep you at a therapeutic range with every other day. Since this one is a little bit newer to the market, I think that we're going to find different avenues, different regimens for different people. So it's going to be touch and go. I wouldn't necessarily be upset about trying something like that. I would say at the beginning, kind of like what you said, you have your negative side effects at the early dosing, and then it kind of subsides as we get further on into increasing our doses. So it could just be that. And that's what I would prefer to do once we get to that higher dosing. If you're still having some negative side effects at that point, we know you're at a therapeutic range, we could try that every other day and see how that does.
Yeah. And so with these, so obviously with the injectable, I know we do a lot of education with the patients regarding, what their diet needs to be, moving forward, because you really have to consciously think about, like, you're going to need some protein, you know what I mean? And so are you providing that same type of dietary education for individuals that are starting on so it's basically,
Yes.
And that's what I feel like that's so important, because a lot of people, it's like, I feel like a lot of people miss that, and it's like, it's so important for muscle and everything associated with it. But it's like, oh, I'm just not hungry.
Right.
And I know I just heard you in the kitchen just now go, where are you getting your protein from? I have no idea what you were talking about, but I literally walked down the hall and I hear Taylor yelling at somebody. She's like, but where are you getting your protein from? And
one of my coworkers is eating a strictly vegetable diet.
I'm a pretty big stickler. My patients could probably vouch for that when we have our first consult, I want you to know that this is not just a crutch. I do not expect you to, I guess, get much out if you're not putting much in. So we need to look at protein intake, fiber intake, water intake, and then other lifestyle modifications too. It's not just your diet. You need to look at your exercise routines and, your stress levels, your sleep quality, all of the above. But I mean, protein's so important when we're on these medications. We want to prevent malnutrition. We want to prevent having any issues with like the muscle mass loss.
Yeah.
We know how these medications, they can waste your muscle really quick if you're not using them. So all of that stuff, when patients call me and they say, hey, I've hit a plateau, or hey, I haven't lost enough weight, what's going on? Are you giving me sugar water? I'm like, okay, well, tell me about your diet. How is it going? How's your exercise?
You're like, well, I only had 4 McDonald's French fries today. So basically I could blow away in the wind. No, I think that's like, I really do. I think it's super important, that we always say, injectables are a marriage with skincare. And, in situations like this, that, these oral GLP-1s, everything is going to do so much better in, with a relationship with someone that's helping out. But a lot of people that are like trying to lose weight, and I can use one of our patients for an example. I love him to death. He's great. He got started on GLP-1s, wasn't walking, he was just he was overweight and, didn't really exercise that much, got on the injectable GLP-1s. And as his journey went on, the activity increased substantially to like where now he's running like 5Ks a day.
That's amazing.
And so it's like, I think you really have to, when we start talking about oral GLP-1s, I know the onset of results can typically start after that 90-day mark. Some start sooner, some start after that. But I feel like GLP-1s are really like the long game medicine. You know what I mean? Like, these are things that,
and a good jump start. I mean,
it's just to kind of help you get there. And then it's like, then you can really just achieve everything.
Yeah.
It's like unstoppable.
So Taylor, if there is a patient who's coming in with, tell me contraindications. I know a couple of things like why they could not take the oral.
Yeah. So when we look at your health history, that's one of the important things for sitting down and discussing this with a medical provider. You've got to look at your medical history as far as, do you have a strong personal or family history of MEN2, which is that medullary thyroid cancer? So that would be our contraindication. These do still carry that black box label where it's potential that could increase those cells or that cell growth. So we got to be mindful of that. Otherwise, histories of things like pancreatitis or gastroparesis, you've got to be very mindful of these patients too. Not necessarily that it's an absolute contraindication, but you want to make sure you're moving really slow, you're staying at your low doses for an extended amount of time, and really paying attention to your symptoms because these medications can potentiate that risk.
Liver disease, right, with the oral is a contraindication.
I'm sorry, say that again.
I don't think she can hear.
You don't think? Say it loud. Say it for the people in the back, Taylor.
Liver disease, With the orals.
She's talking about liver disease with the orals.
Oh, liver disease. Sorry, it keeps breaking up. So there is some risk for like liver dysfunction because of the way. Well, I really wouldn't say so. When we have things like the non-alcoholic fatty liver disease, we've seen these medications help improve status with that. As far as everything else goes, absolute contraindication I really need to sit down and look at your history, and we need to compare those to your labs. And then if we needed to have your primary care on board, or if you're being followed up with internal medicine, GI, or endocrinologist, like we could always, be a team on this. But for the most part, it's really more so, everything's so individualized when it comes to this.
Have you had a lot of patients, I guess not a lot of patients, but is this starting to become more asked for? Like, obviously we see it all the time, oral GLP-1s, the Wegovy commercials and everything like that. Obviously it's hitting mainstream with this. Are people starting to talk more about it when they're coming into your office? Are you starting to see a shift to individuals asking more for an oral option versus the injectable that's been around, forever now?
Yes and no. I think that a lot of it, when you see like TikTok trends and things like that, a lot of times that's where you can kind of follow your patient load based off of those things. I have seen more patients really starting to ask those questions. Is this available to you? What do you think about it? I love them, but it, again, just depends on each individual. I've also had patients ask about swapping to oral GLP-1s after they've met their weight loss goal and use it like as a maintenance. So it's starting to get more popular as the word's getting around.
Now, I will say with GLP-1s in general, and I know we talk a lot about different methods of administration on a whole realm of medication. I do still, and Taylor, you can weigh in on your opinion about this. I still do believe that the injectable GLP-1s are more effective, quicker, than you're going to have in the oral. And I mean, this is no different than when we talk about testosterone and creams and versus injections and pellets and all that kind of stuff. I do still believe that the injectable GLP-1s kind of still hold that superiority.
The absorption
the absorption is like unmatched.
I agree entirely. There is, with the studies, with these most recent clinical trials, the weight loss is comparable. We do see with injections about an average, I'm going to say average, and it's not going to be the mainstay for everybody, but 15% of weight loss with injectables. The most recent clinical trial that happened with these, it actually reported most patients were seeing like a 12% weight loss. So pretty comparable.
Is that within the same time frame?
Yes,
time frame? Okay. Yeah. I was just curious.
Looked at like 88 weeks after stopping these therapies too, how long they were able to maintain, or if it was one patient that was on like a placebo versus remaining on the medication. They are pretty comparable.
Okay. Are you, I know you had made mention about, individuals asking about the maintenance aspect of it. So, is this a good option for that? Do you think that patients will continue to reap benefits and everything like that with moving from the injectable to the oral?
I personally think that is a very likely, option that will be available. I think I don't have any patients personally that are trying to use this as a maintenance, dose at this time. But I think that if we can try it, I'm all for giving that a shot. It just depends too. I feel like when you've been on an injectable like this for as long as you have, either through microdosing or even just that once a week, it may be a little different and stay compliant with that regimen.
Because that's completely different. Like we said, with the waking up and all that kind of stuff. Would you go to an oral GLP-1 and then transition to an injectable GLP-1? Like would that, like for patients that are just starting out, it's the first time they're sitting across the table from you, is that one of the things that you might offer them? Like, hey, you can start with these pills, see how it works out, and then move to the injections.
Yeah, absolutely. I think that would be, honestly, for people that are afraid of the injection or just want to kind of test the waters, this is a perfect route for that. Go ahead and start with the oral GLP-1. Let's see how you feel on it. It doesn't feel like a huge commitment. Even though, I mean, it's the same medications, right? But for some reason, something like that, I think it's because I feel the same way. If it's going to work, it's going to be an injection form.
Yeah.
It just feels like less of a commitment for a patient. So test the waters, dip your toes in, and if you want to swap to injectables, we'll talk about how we can compare those dosings to each other.
Yeah. Now I do feel so, when we first, I don't know, we started doing the podcast like a year and a half ago. One of the first episodes that we did was regarding GLP-1s. And I believe at that time, like we were really talking about how everybody was still like a little hesitant to tell you that they were like on a GLP-1 and they were doing the things,
it was taboo a little early on.
It was a little bit of the taboo, but yeah, I'm like, now that I feel that, like we said, with mainstream media and everything.
I think it's the other health benefits that, I mean, the studies are proving that this is not just a crutch for weight loss.
We had a cardiologist not too long ago that we were talking to in the Baton Rouge area. And he had kind of found out where we work because you know how me and Dr. Weiler love a hospital food. So we go to the Baton Rouge General all the time. And we go to the cafeteria all the time to eat. And we were kind of, we were sitting down talking to a cardiologist that we knew. And he was saying that a lot of his patients that he sees that insurance won't cover GLP-1s for whatever reason, whatever it may be, that he was like, I'm probably one of your biggest referrals because of the health benefits from my side of medicine. He was like, these patients going to y'all so y'all can manage that for them. And he was like, and I'm basically just sitting over here reaping the benefits of what y'all are doing from a cardiovascular standpoint. Wow. And so it's like to hear that from, because I do think like sometimes, depending on the person, it's like, oh, you don't need that. You don't need that. But to have another medical professional in the healthcare, cardiologist come up and say like, what y'all are doing is great for my medicine as well. Yeah. And so it's like, it's really nice to hear that part of it. And like you said, it's just the array of benefits that you can get from the oral GLP-1s. I think it's starting, everybody's starting to realize like, oh, it's not just weight.
Right.
And also like, who cares
right.
if I am taking a GLP-1 to look hella fine
and
in a bathing suit,
making you more active, what you just said.
Yes.
Like
and I think, well, like Dr. Weiler, I remember when we did our first oral GLP-1, he was saying it's like, it's one of those things that it kind of forces you into making an appropriate choice when it comes to what you're taking in. And so it's like, because when you eat the French fries and when you eat the hamburger, you're going to feel like you are going to feel awful.
Yeah.
So it's like you start getting these, it's like that unconscious mind.
Yeah,
mind?
I got it.
You know what I mean? It's like you're starting to get that to where it's like, I'm going to choose the carrot and hummus over the French fries and
because you're going to feel better.
Ketchup, because you're going to feel better. And so it's like little things, like the benefits like that in general. I mean, that's amazing that it's like slowly retraining your brain how to pick food appropriately.
Right.
Okay. So Taylor, obviously you see, before we get to that, Taylor, how are you using this in combination with hormone replacement therapy in these, perimenopausal women, menopausal women and men and stuff like that? How are you using these together as combination therapy for the patients that are coming to you?
Yeah, so we know that I kind of hit on it a little bit at the beginning when I first started talking about this with y'all, but there are a lot of reasons why we see metabolic dysfunction. And it's not just because you've got some type of character flaw and you just don't eat well. or you don't exercise. It could be a hormonal imbalance. Obviously, perimenopause and menopause, and then our andropause, we do see a decrease in our hormones. We see that imbalance there. We have there's too many hormones for women, right? There's 4 different ones at this point that they've got for estradiol, or estrogen, I should say, in the body. Whenever we're in this menopause phase, we've got this imbalance where our bad estrogen is starting to take over, and it loves fat. It loves it. And so then we see that increase in insulin resistance. We see the fat gain that we're at. We see those weird food cravings and noises. We see the depression and anxiety that can lead into other, issues with our food intake. So there's a lot of things that lead into it. We've got to look down and see what imbalances are present. Is it endocrine? Is it hormonal based, like as far as where you're at in your life? Is there something that's affecting this? And then we go from there. But optimizing those hormones can really make a huge difference in someone's life and potentiate the weight loss that they may experience with just being on GLP-1s alone. And that can go between optimizing estradiol, optimizing progesterone, making sure we've got a good balance between the two. And then for men, making sure that their testosterone is optimized. And along with that they're not having an excess of estrogen where they have those estrogen dominant symptoms too. So it's a whole big ordeal when we look at all of this stuff for these patients. It's way further than, hey, I need to lose weight, help me out. It's like, okay, well, we're going to look at you from head to toe and tell you what this is the exact steps I would take to get you to your best you.
Yeah. So, I mean, and I feel
it's
like
completely safe to take testosterone, HCG.
It's absolutely safe
semaglutide.
Yes. So for hormone imbalances and everything like that, it is completely safe to take all of our hormone medications as well as our GLP-1s together. And like we said, this is complementary medicine. And so it's like you said, we're treating the whole person here. And sometimes we are unable to, you can take GLP-1s all day, but like she said, if your hormones are completely out of whack, like it's just gonna be like, man, it's just not gonna work. You're gonna need everything to act together. So, okay. And then obviously, Taylor, the last thing we always ask everybody is if you have an individual that's kind of on the fence about it, not quite sure if oral GLP-1s or injectable GLP-1s or anything like that, what advice would you give that individual?
Or where do you start?
Where do you start?
Blood draw.
We can totally get into that. Okay. Before we get into that, like Taylor said, where do you start? So at Rejuvime, and I mean, Taylor, you can kind of get into this. You always come in, get your blood work done, and then you get to sit down with lovely individuals such as Taylor herself to kind of go through what your goals and everything are. And while you're doing that, if that is something that you're kind of thinking about, Taylor, how do you guide that conversation with that patient?
Yeah, so we start at the very top. Whenever we're looking at labs, looking at the CMP, which is your electrolytes, your kidney function, your liver function, a lot of times that can give us even just a start on being able to determine, hey, there is something going on here. And that could be the liver function or your liver enzymes are a little bit on the elevated side, your kidney function suffering a little bit. Some of the electrolytes could be a little bit imbalanced, but for the most part, we start here and we say, okay, we seem like a mostly healthy individual. You seem like you would be a good candidate for, our therapies moving forward. We look at your cholesterol panel, especially when you're fasting. That's give us a really good idea of how your body is handling this, whatever you're intaking, or either how your body is able to manage the extra lipids that you have floating around in there. That would be a great place to start too. We talk about over-the-counter supplementations. It's not just things that I'm, offering to you to buy from us, but we look at over-the-counter options in managing some of those differences that we see as far as like an elevated lipid panel and things like that. We're going to look at your CBC, see if you're a candidate for things like testosterone therapy. People that have high blood counts may not be a good candidate until they're able to go and get some of that volume off. So we look at those things too. All of this, again, like I said before, is tying into our, I don't want to say our sale, but our conversation on what would benefit you if GLP-1 is a good option for you. When we move on from all that, I go through our hormone panel, say we're a female and we're still in this like menstrual cycle phase of life. We're going to compare those hormones where you're at in your cycle, what day cycle you're at. If there's any imbalances that I see there, we want to look at your estradiol and your progesterone ratio. Is that good still? Or do we see that we're in a progesterone or an estradiol dominant state? Those are important too. Moving on from those, we look at your hemoglobin A1C. Obviously, a good start is if your A1C is elevated, then that's a problem. And like what you said too with the cardiologist, how he said insurance gives us such a hard time. Patients, I feel it feels so unfair, right?
Yeah.
You're in this pre-diabetic range, and that's a warning sign right there. Why do we want to get to the point where we're diabetic is when we're able to actually have access to medications like this to keep us healthy. So that usually is where we see a lot of eyebrows raised when we look at that A1C, they're being right there on the edge of pre-diabetic or being in the pre-diabetic range. We had that conversation about the tight blood sugar control that these GLP-1s can give you, and how that goes so much further than just blood sugar control and helping with weight loss. Again, your whole lifestyle can change from these medications. And, being ashamed should be nothing like that. Yeah. I'm on semaglutide myself. And I've had nothing but good responses from it. Weight loss is great benefit, right? But when we talk about inflammation, I have chronic back pain. And so I've got degenerative disc disease for back. And the difference in that between before semaglutide and now, insane. I'm in jiu-jitsu. I run long distance. I'm able to do all those things without being down for multiple days.
She's in jiu-jitsu. Yeah. That's going to have to be a whole other conversation. But like straight up, she does jiu-jitsu.
Oh my gosh.
She could kick your butt.
Oh yeah.
She could kick your butt. She's actually the one provider that we have that could probably look you in the eye.
You're tall.
How tall are you, Taylor?
I'm 5'11".
She's taller than me.
She's taller than you. See? And I have to look up to.
Oh my gosh.
I have to look up to this Taylor all the time. You should see me and Taylor stand next to each other. When I came for
my interview, I was wearing heels, and I think I was like looking.
I came up to Taylor's waist.
Oh my gosh.
It was definitely, what was that movie?
You go, girl.
What was that movie with Arnold Schwarzenegger and Danny DeVito?
Is it Big?
Twins.
Is it twins?
Yeah, no, it was twins. That was her.
It is twins.
Arnold Schwarzenegger and I was Danny DeVito, standing next to each other.
That was the same for me when I was training with Allie.
Oh gosh.
Allie, our other was so tiny. And then there's me sitting in the back. I remember all of our patients, when they'd come in, they'd be like, "Oh, you are so cute. You look like a little teenager." And then they just look at me and smile. And I was like, "I know, I'm a linebacker." I know.
But you're also a linebacker that can kick their butt.
Yeah, so right.
There's that.
Well, so cute.
Taylor, thank you so much for joining us today. I absolutely appreciate you and all of your insight on this super hot topic right now. And it's a super hot topic for the past year and a half. So thank you for joining us. And trust me, I'll absolutely get you back on here. So for everyone else, make sure that you subscribe below. Make sure that you subscribe below. Make sure you're liking us, following us on all of the social media platforms, listening to us on wherever it is that you listen to your podcast. And remember to always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.